evening. We'll just start in a moment. Okay. Hello, everyone. My name is Aurora Shweta, and this webinar on mental health is a social initiative by LawSikho. Today's webinar is an attempt to find a few answers together by bringing forth a discussion about a topic we often talk and not talk about. It's a topic that we also casually use in our day-to-day language, so much so that we don't realize we tend to take it seriously. Oh, I'm feeling so depressed. I hate my life. I feel I could give up. We deny it when it comes to doing something about it. But it's be it seeking counseling, medication, help from those who can genuinely care, we don't reach out. Neither we realize how grim our situation is, nor others in our environment. Let's try and understand today the various stages of depression there are, and when does it get severe enough to meet the doc. Today we are here with Dr. Nikhil Raheja, practicing psychiatrist for last 16, 17 years, and has helped thousands of people fight this battle against depression. Over to you, doctor. Thank you.
We are here to understand, to identify, and actually to do it, try and do it on our own, not for ourselves, but for our families, our colleagues, our support systems, and our friends. That if they are going through a rough phase, if they're going through a low, how to pull their hand and pull them out. And when we are low, we shouldn't be ashamed or embarrassed about extending our help and looking for help to be pulled up. So first of all, we need to identify what exactly is depression. Depression sounds like a very fad kind of a word, as you said. We use it probably more often than we use the word toothpaste. When I'm low and I'm going through my downs, and this is happening and the work is not happening. But is it actually depression, or we're just creating something out of nothing? Or is it actually something serious fermenting and I'm just taking it too casually? So we need to have a definite, defined paradigm to understand that what exactly do we look at, what constitutes, how do we identify what affects me when I'm not going through a good phase, so that in future, after this webinar and after all of us being together, we should be able to not just identify for ourselves, but also for our friends, our families, and I said our colleagues. Because you might find it very startling. Depression at some point of time affects almost 25% of a population. And at any point of time, it affects about 12% of the population. There are over 300 people who commit suicide in this country every day. And these are not just, thought of numbers. These are defined numbers which have been registered. If we talk about which are not registered, which are non-documented, the number multiplies by at least double. So it is actually a very serious, a very ticking time bomb which we sit on. And unfortunately, ma'am, we also need to understand that as we migrate from a rural population to a metro population, this number constitutes 80% of the people who go through this. So when we talk about, in today's cutthroat world, today's rat race, although the current situation has really slowed down the rat race too, which is probably a silver lining or a flip side to it. But we also need to understand that the kind of pressure lives which we are living, the kind of runs which we are doing 24/7, work, pleasure, family, responsibilities, many hats, many masters. But are we actually doing justice? I don't think we are doing justice to it. Maybe we are pulling ourselves like a rubber band. We just go on pulling ourselves, and there comes a time when the rubber band snaps and hits back. So before it hits back, it breaks. It's time to unwind, time to lower the tension and get better, identify, and make sure those noxious things are out of our day-to-day working and we move towards a positive future. So when we talk about depression, depression doesn't mean that I'm crying. Depression doesn't mean I'm vegetating. Depression doesn't mean that I'm thinking of harming myself. Depression could be just pure lethargy, that in lack of energy, not to get out of the bed, not to speak to anyone, not to get your proper meal. It just might be carrying a frown or a burden throughout the day. The whole day becomes a pain where life is a relief. Night comes, you say, okay, it's a relief, but the day is a pain. We need to understand that that itself is depression. I'm not wanting to speak to my friends. I'm not wanting to communicate with my family. I'm irritable all the time. I'm running mild, low fever. My hair loss is happening. My skin is bursting out. We keep hearing all these things and experiencing all these things. These could be and also are very, very significant signs of depression. That is the starting. So we should know that how do we stop the first part so that it doesn't transform into something what we call as clinical. The second part about it, when it starts getting serious, is that I start vegetating. I'm not able to get out of the bed. For me, even a step becomes a pain. I don't want to do it. Somebody defined depression as that life is a punishment, life is a disease, and to end it is a relief and a cure. And that is the time when we think about saying that I don't want to go through this pain anymore. I don't want to cope up. Then no incentives, no worldly pleasures, no responsibility pressures, no incentives at what I have in the bank or what I don't have in the bank doesn't matter because you're going through pain every second and you need to overcome that to get out of it. And for a person who doesn't want to have recourse to a professional help, that the social stigmatization or unavailability of resources, or that people will start getting judgmental and subjective. Oh, you go to your elders and family and you say you're not feeling good. The commonest thing is ऐसा तो कुछ भी नहीं होता हमारे साथ होता था तो we used to go for a walk and used to come back and we used to be fine. So you get scared, you're apprehensive to talk to your family, your friends. You don't want to reach out to a therapist because the stigmatization that he's lost it, that person is of no good. We, no matter how much we deny that we are how much we say we are educated, we are intellectually liberated, and we are scientifically knowledgeable, but once it starts happening to people around us, we have this really bad subjective coloring to label the person as though this is not good, good anymore. So here today for the next 1 hour, as people will ask their questions, to understand, to identify, and I think most rather than me continue on a monologue, let's make it an interactive session. So, and I think a lot of things, almost everything would get answered in the questions. And if anything does remain, I think we can take it in a final submission and submit.
Great, great. So my question in the beginning was, when do people realize that this is a stage where medication could help them? Maybe a minor medication, maybe just a very small dosage.
Whenever we make a diagnosis, Shweta, we make a diagnosis, there's always a footnote in psychiatry that the disturbance should be significant enough to start impairing your daily functioning vis-a-vis your work, your family life, your pleasures, your social life. If it is not affecting that, we all go crazy for a few minutes every day at some point of time, but we bounce back. Like, for example, a husband and a wife, or a girlfriend or a boyfriend, or a boss or a subordinate, they're fighting, and one of the person says, I wish I could kill you. That doesn't mean that you've lost it, but then you rationalize, your temper settles down, your emotions start settling down, and you go on. You're doing your work, you're doing your family responsibility, companionship, bonding, everything. But the minute your daily socio-occupational personal life gets affected, you're not able to get up, you're not able to look after yourself, your appetite sleep gets disturbed. For you, everything is an effort. You don't want to face the world. Your self-image is gone. Your own self-esteem has taken a bump. That is the time when we know that to reach out, whether it is therapy, whether it is changing my environment or a little bit of medication, this is the time. So we should always say, okay, now, I was what, 2 months ago? This is not me. And this is happening persistently for the last 10 days, 15 days, 30 days, a month. We need to understand that that is the time to reach out, because at that point you're on the first step, and reversing the first step is always easier rather than jumping on to going to the 10th step and then reversing.
Correct. Thank you. That's a very good answer. So, since the topic that we had today in mind is talking about the causes, symptoms. Now, the symptoms that you just covered in your answer, they're so common that it can happen to every other person every other day. So when is it that you really know that this is really and how is it a duration that people have to be in that mood, or that symptom has to persist for that long, and that's when they realize it's depression? Or how would you suggest?
What you're saying is absolutely correct. As I said, age should be significant enough to disrupt my normal life.
How many days?
Sorry?
For how many days? Let's say I couldn't
That's
work.
what I'm coming to. The second thing is that it has to be persistent. So when we talk about persistence, in a layman's term, if we've started experiencing it more than 2 weeks, now that is the time when I know that my normal life is affected for the last 14 days, 15 days. Now is the time to start seeking.
Okay. What are the causes, doctor, if we had to really start from the start, as in everything is hunky-dory, life is beautiful, and suddenly you have these pangs? Even celebrities like Deepika Padukone, she came forward and talked about the fact that she was absolutely happy with her career and beautiful relationship with Ranveer. Everything was going for her, and she felt depression at the most unexpected phase of her life. So she didn't know it was depression. It was her mother who said that you might need to see a psychiatrist, Deepika. So that's what I was reading yesterday. So when is it that...
Sorry.
No problem. Yeah. So for people like those, that everything is absolutely fine and it suddenly happens, what could be the cause?
See, basically, every human being and every disease is a combination of your nurture and your nature. So your nurture is your environment, and your nature is your own genetic predisposition or a diagnosis. I have seen people, clients, for whom being super successful, right at the top, and then you go into a depression because they're now next what? There's nothing to look forward to. I've done there, I've been there, I've had billions in the bank. Where do I go from here? And that itself is a depressing thought that I've nothing is left to be achieved. So when we talk about celebrities or we talk about super successful people, a normal layman would say, what's wrong with him? He's gotten everything going for him. But he says, now next what? I the only thing next is to meet God or become God myself. So, that itself is a cause of depression. But if you talk about purely technically, any environmental stressor can lead to what is the depletion or stopping of production of the happy chemical in the brain, which is called as serotonin. So it is consistent, biologically, whether it may be an independent genetic issue or also it may be an environmental issue where, something has triggered lesser production. Serotonin levels continuously continue to deplete in our brain cells and neurons, and that is the biggest cause of depression. So all our treatment modalities, whether environmental or biological in terms of pharmacology, are targeted at increasing the level of serotonin in the brain cells.
Great. I'm glad that you covered serotonin. So it's something that it stops producing in your brain, did you say?
Lesser. It doesn't stop, but like it gets reduced to probably a factor of 10x divided by 10. So that is like as good as nothing.
Yeah, so that is where medication comes into picture to create those.
Absolutely. No, there are normal, natural, environmental ways also to increase serotonin. One of the most potent, you might have heard of, we all are like, very active people, but you must have heard of, I'm high on gymming, I'm high on exercising. So physical activity does increase the level of endorphins, enkephalins, and serotonin. These all three are the feel-good neurochemicals of the brain, significantly higher. I mean, these days, people, when they're traveling and they have to choose a resort, people who are like gym high, they would first, go to the site, see what all activities are there, rather than looking at, what room I'm going to stay or what food I'm going to eat. They look at, what activities I'm going to go through. So they are hooked onto it. People can't live without running their 2 miles a day. People can't live without, doing their 1 hour in the gym every day. So that's actually biologically proven to increase the level of, feel-good chemicals. As I said, these are endogenous opioids and serotonin, which are increased by these. There are other ways. People are high on spirituality. People are workaholics. For 10, 18 hours of, working a day is a high. Women generally, a lot of women are high on shopping. You give them a few lakh rupees and they'll buy and they won't even know what they bought, but that feel good is going to be immense. Men are high on bad things like gambling. So, these are things which are naturally, they might be good interventions, they might be bad. But as much as biology is important, as much as your own natural changes, environmental changes are important in recovering.
So it's a vicious circle. Then, if you're depressed, you will not really feel up to it. You will not feel like going to the gym, and you will not be able to increase the required chemical in the. So it's something very vicious. There are a couple of questions more. I will ask mine a little later. There is a participant who says, "How can we help? Biggest slap of mental illness is comparison. How do we not do that, and how do we be okay rushing to be successful all the time?"
See, again, we need to understand a couple of things. A very apt question, whoever's asked it.
Competitive, yeah.
We need to understand that, we need to be, the contentment is in my eyes. It's not in a job, it's not in a promotion, it's not in an increment. There's no mobile phone, there's no car which can give me contentment. So let me put in my best efforts, not rush into it. In fact, rush is gonna make your performance impaired, which might not give you the desired result and appreciation or appraisals compared to what you're doing with a calm mind. Also, we also need to know that nobody can be right and successful all the time. We will have our ups in work, we'll have our downs in work, right? So do your best. Think about, at the end of the day, you should know that I have put in my best. Results, they will automatically happen. Secondly, my ability to tolerate frustration should be as good as ability to tolerate my joys and my gratifications also. We rush towards, as I said, getting a promotion, we rush towards getting an increment, we rush towards buying a new thing, but we should also be equally stable in dealing with a setback, with a reprimand, with a not a too good an appraisal. So these are things, ability to delay gratification and not being able to control your impulses. They are an important part in preventing you from rushing towards something which may be achievable, which may not be achievable. So the pull theory of motivation, as we said it, we see something and that pulls us. So I work harder, but I should not fall. I should not falter. That is how we should, to go about it.
Yeah, doctor, see, this is for me, it's more like when you're in a high life state and you're mentally healthy, so you can think so logically. We're talking about people who do not have the ability to think of the ideal way to deal with situation. They're unable to deal with it with that reason or rationale or that kind of logic that it's not correct to be competitive. It is, so they're operating from the place where they are just incapable of any happy thoughts or positive thoughts and everything. So just there was in our team we were discussing today how we could really deal with the issue like this, maybe right from the school. They should be, the values should be such that the competition becomes irrelevant, or they should be introduced to things which are very positively around without effort. So depression shouldn't creep in also for them to really be, feel that they're unable to fight it. I mean,
I'm sorry to interject. Unfortunately, in our world, it's not just Indian perspective. Throughout the world, my happiness has been given a very, very small and an ill-defined, microscopic, myopic viewpoint that how much you earn, how many degrees you have, what kind of a house you live in, what kind of appreciation you're getting. But if we look at it, is this actually just happiness? Yes, this is a very important component of happiness. But as happy as I could be being a millionaire, as happy I should be being, like able to sustain in a few thousand rupees. So that is for me, driving an XYZ automobile should be as pleasurable as walking for 5 kilometers. So we need to expand probably, because what we've done is we've conditioned our happiness to a very limited criteria. The criteria needs to expand. What point? Okay, today we talk about, bad times because of Corona. We all are going through tough times. We all are surviving financially, physiologically, where the threat of the illness and including fatality is hanging on everybody's head, right? How many people are actually using the money they want? How many people are able to take out their automobiles and go for a drive, go to a restaurant, go to a club, go to anywhere? We are scared of meeting our own family members. Please correct me if I'm wrong. Tell me if somebody is doing on the contrary. But so we need to expand, being happy, being spending time with the family, spending time with your children, doing activities we never did. I think it's bringing a lot of joy to us. I mean, we all go through social medias. People have been posting what they've been cooking, the pictures, sharing with each other, their physical activities.
Yeah, it's been a healing time for many years.
Right. So we probably what we need to do is that definition of happiness needs to expand. I'm not saying that what we're thinking is wrong. Of course, financial and materialistic gratifications are as important, but on an emotional and a basic level are equally important for me to survive. For me, I mean, I don't know, I think most of us are, world travelers and we've traveled. It's so beautiful to go to, Europe or anywhere and see people winding up at 6 o'clock. This is even doctors. I have my colleagues who, migrated. It's impossible that 6-5, you'll find me in the hospital. Only if I have a duty, I'll be there. Otherwise, I'm back home with my family. And that gives me so much pleasure and happiness.
So I have a few questions. If you want, I could take from the audience as well. There is somebody who's talking about medication, and what if she says I would want to ask about it, like about the relation between taking medicine and getting addicted to them. So her question is, if she starts medication because it's needed, it's dire need. So how long, is it before she quits so that she doesn't get addicted?
Right. Okay. First of all, that's a decision a treating doctor would need to take because these would be based and dependent on a lot of factors. Whether we are dealing with either it could be a situational or a reactive, like I'm faced with an adverse life situation, which a lot of people, a lot of us are facing in today's time because of being locked up, job insecurities, lack of stability and fear. So this is what we call situational or reactive depression. So this once with the medication, we look at about 4 to 8 weeks, maximum 12 weeks. You're off it, you're recovered, you undergo your certain lifestyle changes, you make interventions, social interventions, maybe have a couple of psychotherapy sessions, and you're off it. But if you have a genetic major depressive illness, then the treatment becomes slightly long. Probably in layman's term, if I can answer, the first episode says that the number of days you've been having symptoms for, let's say, 1 month, you need to be on medication multiplied by 3. Okay, if you've been having it for 1 year, you need to be multiplied by 3, that's 3 years. But after stopping the medicine, if the symptoms, they keep coming back, which we call as the severest form of depression or recurrent depression, it keeps coming back, then medicine becomes a lifelong thing. But again, these medicines are not addictive. It's like we've all heard about diabetes, right? Diabetes is deficiency of insulin in our blood, and that's your sugar levels rises. So if you are genetically serotonin is deficient in your brain system, and if you're supplementing it from outside, like breathing for oxygen, like eating 3 meals a day for energy, which our body can't manufacture, you're not addicted. It's just that it's deficient and you're using it, you're supplementing it from outside. So don't feel that I'm dependent or addicted to it. It's a necessity which your brain or body can't produce. and you use supplementing and taking it.
Very good answer. Very good answer. Because I'm also taking a BP medicine, like, and I have to take it, continue it like almost forever. So that's not addiction. That's the requirement of my body. So similarly, for any medication that.
Three times a day we go for our meals. Even the biggest bosses,
Yeah.
go
And second,
30, they say like boss is having his lunch, come back after lunch because our
correct.
body can't produce ATPs and
Correct. And also, sir, depends on the medicine also. I mean, the doctor that she's consulting or the medicine that she's taking, that also depends. I mean, it's all relative. I mean, we're talking about
I think let me just advise you one thing. Your doctor means the best for you. And doctor would be your biggest well-wisher. Have faith, have trust, and let him decide which medicine, when to come on, get on. Don't be your own doctor.
Request. Okay, there is one more question. If father and mother are diagnosed with clinical depression since very young age, is it possible for children to get it? It's a very unique.
The risk factor for children to get it is if we don't have a family history, if it is 2%, the risk increases to 5%. That's it. Otherwise, there is 95% chances that you'll never get it in your life.
Great. That's a relief. Somebody wants to know if you don't feel like exercising, like you also mentioned in the beginning, and you feel very lazy, how to deal with it, how to pull yourself out of that.
Make some good friends, start doing some activities slowly, buy a new bicycle, maybe pick up a badminton racket, climb a few floors up and down on stairs. Do this for 2-3 days, and this will automatically start happening. Once you start sweating, there is no higher than exercise.
Super answer. And you get so addicted to exercising, you'll surprise yourself. The day you don't do
it's
it,
unbelievable. It's better. I mean, between all of us on a very, very, friendly way, it's better than having your 3 drinks in the evening.
Yeah, correct. So even if I can't exercise, some days they're not my favorite days because I'm so addicted to that. In depression, don't feel like it's okay. This one we've covered. A cautious approach or thinking of hurdles first in tasks to be performed. Can that be a stage of depressing personality? Because other people usually stamp such an approach as negative person. So she's trying to ask.
I get the question. Let me just tell you, being cautious doesn't make you a depressive personality because maybe you're doing things better. People who tend to get on the higher side and overconfident and try to do too much too soon can get more setbacks and are more prone to depression rather than people who go slow and then who are able to conquer one step at a time. Proverbial story of the tortoise and the rabbit. So the rabbit never became depressed. The tortoise never became depressed. It was a rabbit who lost and became depressed. So if the ambivalence is too severe, it is impairing your performance. It doesn't let you take decisions. It doesn't let you complete your task or your work or your projects at hand. Then we need to take corrective actions. If you're just cautious, if you move ahead it, if you're just taking an hour extra or a day extra, please, I would appreciate this rather than trying to do too fast and then faltering and then saying, oh God, where did I lose this?
Very good answer.
For example, just to sum this, we normally talk that, oh, I'm stressed and it's bad. No, stress is always good because it helps you prepare for the situation better. But when the stress adds a distress, that is when things go bad. So stress is fine, distress is bad. So being cautious is good, but if that cautiousness is impairing you, you're like going into a panic mode and not doing anything, that is bad. So then we talk about it.
Very good answer. And also seeking validation from other people to call you positive and negative. I think that is also something we need to somewhere reflect on. That if we enjoy being cautious, and that is something that should be ideally strength. We should believe in us, ourselves.
See again, positive validation as well as negative criticism will automatically come. Why do I have to look around? I have to look into my own self, my own eyes, my own mirror, and say that I put in my best. Let me do my best, and let people come and tell you that you're a good doctor or you're a bad doctor. Like I still, when I see a new client, even today after 17 years, I know at the back of my mind that I have to give results. But I don't go asking that, okay, are you satisfied? Are you happy? Let him come back and say, "Na dog, you did a good job with me." So don't seek; they will automatically come to you. You have to see that I am going to put in my best efforts, which may
Perfect.
succeed at times, which may be a disaster at times. No doctor is perfect. We've done our own blunders, we've done our own fiascos. Your DNA, your brain should keep organizing memories, experiences into becoming you a better professional, a better human being, a better person in totality.
Do you believe in affirmations like people these days are talking about? You wake up in the morning, tell yourself this. Does it work for the mental health patients? No?
I think at the end of the day, it starts happening at a spinal level. Your brain starts working at a subcon. Once you work at a subcon, any professional, that is your best way of working, because neither you're taxing your brain, neither you're burning yourself out. And it's an automatic process where all the permutations and combinations are sorted. And the minute you start doing your task or you start seeing a patient, automatically the best of everything emerges. It's like, one day before our board exams, I think we've all done that. We all used to be in panic. We don't remember anything. But the minute the question paper used to come, so those answers used to, come out. And the rest of the things used to settle down, and we used to do well our papers and we used to come back home happy. So it should not be an effort. It should be an autopilot. It should not burn you out. It should not eat up your working, because that is going to impair and make things compromised.
Somebody wants to know how to deal with insomnia. It's also another critical cause or symptom of depression.
See,
It's also a cause, and it's also you've mentioned when we were discussing.
insomnia, sorry, is more of a symptom rather than a cause. Because if we talk about independent insomnia, I see probably 1 out of 10,000 cases where life is going on perfect. It's only my sleep is which is disturbed. So we need to understand if insomnia is a cause of depression. Again, as we said, first let's try, environmental or interventions, social interventions. If that doesn't work, then we need to get onto medications.
For insomnia as well. You also mentioned lack of sleep sometimes causes depression when we were discussing.
Yes, because the lack of sleep at proper times, there is something known as what we call as a biological clock. Okay, so our body for millions and millions of years have been tasked to perform according to the diurnal clock, or the sunlight, the sunset, the night. That's how it always from millions of years. Now for the last probably 30, 35, 40 years, we've reversed the clock. We are sleeping late, we are getting up late, party hard, work hard, like before this COVID happened, going to a party before 10 o'clock in the evening was a disaster because you wouldn't meet anyone. People would start pouring in at 11 o'clock and people would leave by 4:35 in the morning. So when we wake up at times, see, once in a while, once a month, once in 15 days, it's good fun. You can do it. Sleep the next Sunday off. We all are happy. But if you persistently do it, whether even if it's work related, because with lot of IT and backend processes and all this, the working hours have completely changed. So that slowly, steadily starts altering your biological clock. So the hormones and the neurochemicals supposed to be secreted in the night. Now the body's conditioned to secrete them in the morning or afternoon when you're going to sleep. That is disruption, and that definitely can lead to anxiety and depression.
Okay, there is the next question is very close to my heart. At one time, I used to think that I want to be the happiness manager. That would be my designation. Whoever is unhappy, I would try to. This girl has asked, how can we help people without hampering our own mental health? It kind of consumes.
Again, you need to be objective. You need to dichotomize. It's like when somebody falls into a quicksand, you offer a hand, you offer a rope, you can offer a pole, but you're not going to jump in that, right? So we need to understand, you need to dichotomize self and be objective. Let's say, okay, this person is having this problem. Let me try and stand with that person rather than carry that load for that person. No, don't ever do that. You can support a person, ease out the load, But you don't carry that burden on your shoulders. Let the person say, okay, now you are happy, and let me go. So, like a lot of times, I get this question asked from friends and clients and their relatives. Says, Doc, how do you do this through the day? And says, look, you need to A, dichotomize yourself, and B, you know that whatever I'm doing is bringing a smile to somebody's face, is bringing a value addition, a happiness to a family. So that keeps me going, the incentive part. That's how you go about helping people.
That's very nice. Somebody says, sir, is the medication given for anxiety or depression is permanent like medication of thyroid, or can it be stopped?
I think we already
We
addressed
covered that. It can be
depends
stopped
upon
in
the
consultation with.
situation. Sorry.
Yeah, I was just saying the same thing, that we covered that in consultation with the doctor as to what
It's
your
basically
situation.
individual to individual, situation specific. How it goes, no doctor can predict it. But as the treatment progresses, we do try and wean off the patient off the medication. And almost 70% of patients, they are able to wean off. If another episode happens, 5 years, 2 years, 10 years, we can still go back 3 weeks, 4 weeks, 5 weeks, rather than being on continuous medication.
Very good answer. I think that answers your question, Supradeep. There's somebody who says, what are the problems if one is harassed at several fronts? Does he or she should seek mental help? Harassment.
See, I think again, it depends on the level of harassment. If it is domestic violence and abuse, you need to either sort it out with you need to change the environment. You need to sort it out. If it is workplace harassment, legal resources are available. If it is, an emotional abuse and an emotional harassment from your spouse, your companion, we need to sort that out. So it again becomes specific. There can't be, one rule for everything. One size fits all is not going to be. Yeah, I mean, I can tell you, okay, if supposing you're getting work abuse, meeting a therapist wouldn't just work. That environment needs to change. That noxious stressor, stimulus, which is affecting her, has to be managed. If a person is a stalker, maybe an ex-lover or an obsessive lover, or a too, threatening boss, that needs to be corrected. Support just wouldn't help. Support would make you strong enough. Therapy would make you strong enough to stand up. But the
Effort. But what if they really feel so helpless, and that's when the whole, they give up on that
then
whole.
to make them feel strong, to make them recreate and get back their identity, their individuality, and for them to make a decision that therapy as a doctor, as a psychotherapist is necessary. But eventually you'll need to fight your own battles. Nobody's going to fight them for you. We can make you trained, we can make you strong to fight those battles, but you'll have to fight those battles. You can't close your eyes and say that the lion's gone. The lion is still there. You need to fight it out.
Is hyperness depression?
No, again, hyper very vague word in terms of this thing. If people tend to be very fast, work, they're edgy, they're restlessness, could be a symptom of opposite of depression, which we call as mania. You know, they are super hyper, they are super working, they're super energetic, they want to do multiple tasks, social life is superb. That is reverse. Also, what we see is, which we fail to understand, there's a condition known as attention deficit hyperactivity disorder, which carries it into adulthood, but we are not able to identify it. So hyperness is not really depression. One of the signs of depression is irritation and aggression. A lot of time we say, okay, this person is so irritable and aggressive, so it can't be depression. No, irritation and aggression is a very common sign of depression.
There's a very good question. What about when somebody calls you negative, even though you're simply responding to someone's bad actions? For example, I recently felt betrayed. Can I read, sir? It is something, I think it is a pertinent question, and I think very common. I recently felt betrayed by a close friend and told her that she was being selfish and inconsiderate. And she told me that I'm very negative, which felt really odd because she was the one who did a negative action. So that's normal, right? Telling someone how they affected you when you feel they did something wrong.
If you care for them, it's absolutely right in conveying them. If they don't matter to you too much, please stay at a safe distance, because you can't help the whole world. You can help a few people, but you can't help the whole world. And if somebody close to you, if you've set them to the same thing, you've told them that this was wrong, they might, become impulsive and say something in the short interim. But eventually, if the relation is strong, they'll come back and tell you that, yes, thank you so much. You did this to me, you told me this, and that's made me correct a few wrong things about myself. Otherwise, 99 out of 100 stay at an arm's length. Let their well-wisher handle their negativities, their shortcomings. You only help those who are close to
there is a person who says, me and my sister, who is psychology student, has started a mental health community after Sushant's death. We encourage therapy there, but how to make conversations about mental health problems without triggering anyone?
See, again, we need to understand that, first of all, the most important thing of any psychotherapeutic relation is rapport. So don't get too intrusive from the beginning. You make them, encourage them to join the community, give them time, let them open up themselves. Don't ask direct questions. Always, look for cues, look for signs, develop an individual rapport as well as a group rapport. So, they automatically, it will take some time. Communities, a lot of times when such tragedies happen, Shweta, communities happen, social media happens, there's so much, if we look at it longitudinally, 2 weeks later, nobody would even remember that something like this happened. We would have gone on to the next baggage. So if you are actually well-meaning and if you want to do something constructive, and it's a wonderful initiative you've taken, let it continue for a month, 2 months. Let the ripples get into a wave and let the wave roll. That is the time when people will come to you for help and people will start benefiting. That's how it is. So keep doing it, keep doing it, keep doing it. That's how you'll grow and you'll be able to support it.
Correct. There are a few questions on YouTube also I would like to take. Just medicines for prescribed. 1 second. So there is one question that I just missed reading and it all went up. Somebody wants to know, although we covered, but in great detail would be very helpful, sir. At what point does one need medical intervention or therapy? The symptoms are not very clear when it comes to mental illness like other illnesses.
See, again, you necessarily don't have to start looking at, the medical intervention. Even talking to a friend, even talking to a family member, even, talking, or if nothing else, talking to a counselor. Nowadays in corporate, I think they're doing a lot in HR. They do have access to, counselors or psychologists. Talking to them, identification, adapting, resoluting, and then resolving. So let it be a gradual thing. We don't have to run to a psychiatrist all the time. Let's talk to friends. Let them give their opinion. Trust me, they will not be subjective. They would always respect you. Your respect, their love for you is not going to go down. And in fact, they'll always say that you are a strong person who could have the strength to talk. Let's not be silent. Let's speak out. And the help is right around. I just have to turn my eyeballs, not even use my neck muscles. Friends, colleagues, families, helplines. Even a lot of professionals are doing helplines. There are blogs which are available. So, in the minute you identify, then work towards resolution.
Wonderful answer, sir. Two takeaways from that answer, sir. One is, even if they are judging, I mean, that is something I would like to add. You said that they will not judge, but even if they are judging, it's all right. Please don't feel bad. And second, but when you talk to people, you said don't run to psychiatrist all the time, which means if it's helping talking to some people, if they are able to bring happiness, continue that, and then, that will be it's a good takeaway.
I'll just give you a converse example. When I came into practice, that time even telling somebody that your strength was like, he's half crack. So, but we always stood up. We always said that, yes, I'm proud to be what I'm doing. I'm proud to be a psychiatrist. And that's how life goes on. That's how your confidence comes. That's how your happiness and your joys come. So even if people are, judgmental, and they would be judgmental in a positive way. Judgmental doesn't always necessarily mean negative. It can be a very positive way to say, okay, I really appreciate your confidence to speak out, and also that you choose me to trust with your thoughts. So then it's a both thing. If today people come to me and they speak about their innermost and their, most inner thoughts, insecurities, fears, it's something for me also to be proud of.
Correct. Very well said, sir. Because as a depression patient myself, from personal experience, the hardest thing I had to fight was the fact that I was very fearful or very anxious about people judging me all the time. So what I fought, or how I fought, was that I just realized that people will give you what they have. If they have a judgment and they want to give that to you, it's up to you whether you take it or not. So you
And
cannot change the person's perception or the way they think about you, but you can change how you think about what they think.
if you can't change the environment, you can change the way you look at the environment. The
And
perspective,
meditation.
the perspective of the surrounding changes with every moment of the eyeball.
Correct.
And also, Shweta, what happens is that when I start, confiding, I start trusting people, there'll be a lot of people who will be like, absolutely useless, but at least I'll come to know that they're useless.
Absolutely.
For me, the treasured one, the prized one would remain, and the rest would wither away. And it's good that they wither away sooner than later.
Correct. And so the world changed because of the people who did not worry about people judging them.
Absolutely, absolutely. It's like I need to do this. I'm going to put in my best intention, my best efforts. People who just sat and people who waited were only followers. The leaders were somebody who were different, who thought on their own, who acted on their own, and who accepted and corrected their mistakes from them. So
Correct.
whether you want to be a leader or just a follower, that's entirely your call.
Correct. There's a very good question. How to know that someone in my family is facing anxiety or depression? The person is an introvert.
See, again, anything which changes from the normal, somebody may just have a very silent, very subtle, very introverted personality. You can't blame that. Neither can you change that to more than a degree of 5% or 10%. But if you feel that, the change is 20%, 30%, 50%, if that is happening, then that means that anxiety and depression are happening. So anything out of the ordinary, anything out of the, conventional, stereotypical persons working changes to a major degree and persistently is something that then we realize that we need to reach out and see.
There is a question on YouTube: how to overcome the feeling of being lazy, sitting home all day, liking to sit in dark and being sluggish all day. You did
So
cover that.
if you like to sit in the dark, not being sluggish, not wanting to meet people, escaping from everything, and not wanting to do anything, you need to reach out. This is now you need to reach out. We can't just say that this is a passing phase. You are showing signs of anxiety and low depression. So reach out to a psychologist, reach out to a doctor, and seek help.
Right. Okay. Is there any anonymous helpline or professional one can approach anonymously in Delhi? I'm unable to open up to closed ones, so as well as approach help directly.
What I can do is I can send a list of all the anonymous helplines, whether in the NGO or private sector, and I can forward it and you can post it in the group or whatever this is.
Sure. Sure.
There are 5 6 helplines which work around the clock and they work well. So no, don't worry. I will give you the number.
Great, great. Somebody says, I think I'm emotionally fragile. I start crying on little things. Is that sign of depression?
Not really. That could be a sign of oversensitivity. Let's not paint the whole world with the same brush and my own day-to-day functioning. If you're functioning otherwise absolutely fine, it's just that you're a little more too sensitive or too emotional, doesn't make you a patient of depression.
Just touchy. I have that issue as well. I cry easily.
So it's okay. A lot of attention seeking also goes into crime easily.
Not really. I cry
People come
alone.
running and saying that, so you get conditioned. Attention seeking in depression is also a sign of depression. That, everybody's coming to me, kya ho gaya, what's wrong? Let's do something. Let me do something for you. Let me support you. Let's spend time. So you get used to it. This feels so good.
No.
I'm just telling you, so we should avoid and stay away from attention seeking too. that is also not a healthy sign.
Health. Great, great. Because I just feel that I have this tendency to make everybody's problem my problem, and I reach to the approach that problem as I would reach for my own problem. You know, I start solving it for people.
You
So
need to
that
keep
is,
your distance, because otherwise you'll burn your own fingers. Don't do that. You
they're
need to
all can't.
dichotomize. No, you need to dichotomize, and you need to be there, but don't jump into the fire. Try and rescue them. Don't jump.
Sure, sir. Thank you. Depression problem persists majorly only with introvert people. It's a question.
No, nothing. I told you, extremely extroverted people who remained on a high all their lives can more easily and are more prone to fall into depression because of one failure. That don't think that if you're introverted, if you're too extroverted, you're an overachiever, you're a go-getter, you're a happy-go-lucky person. One setback can push you. Absolutely. Freud, the father of psychology, human psychodynamics, he said that every depressive episode is preceded by an extreme high, and an extreme high is a reaction or a body's defense mechanism to an extreme depressive state. It's like a spring. You press it and you leave, the recoil shoots you up. So from depression, you go into a manic phase. And if you're too high, you can crash land as easily or more easily than a normal person.
There's somebody who wants to know, don't you think a pet or a hobby to pursue will go a long way to keep off depression?
Absolutely. Fully agree. 100% marks to whoever said this. It's an expression of emotions. It's your brain cells creativity. Like when we talk about a pet, it's your expression of emotions which you're not able to channelize otherwise. When a pet comes to your life who can't do a lot of things himself or herself, you have to feed, you have to walk, you have to clean, your energies are getting channelized, your affections are coming out. And when the pet loves you back, that's so beautiful. Also, when you're doing a hobby, you're playing a game, you start doing creative, your brain circuit starts firing. And when they start firing, the good hormone starts jumping.
Great, great answer. There's somebody on that, same question. She said that the one that you said that you were just sensitive but not depressed. This person says, I have another question. How to deal with overwhelming emotions? If I feel I am, is it empathy? I cried for 3 hours when I heard the news of that elephant's death in Kerala.
I think you need to emotionally recondition yourself. Life begins, life progresses, life ends. There is a finality to everybody's life, mine, yours, elephants, everybody, right? We should feel grief, we should feel bad for something unnatural, but it should not to be the point of being self-destructive. So if you're crying for 3 hours, see, this was one elephant we need to know. There are elephants which are skinned. There are tigers which are skinned for their claws, their ivory, elephants. We don't even hear about them. So it should not be self-destructive. It should be, we should feel bad. We should do our bit towards, expressing our thoughts toward it, to put pressure on the relevant authorities or the government or whatever it is. But to sit alone and cry for 3 hours, the elephant is gone. Nobody's seeing you crying. You're only hurting yourself. So get out of that mode.
So it's not easy to switch off for some people, just think logically that there is no point in crying. I am just trying to think from a perspective of a person who has a mental health issue.
If you're talking from a person who has a mental health issue, then it becomes different. If somebody who's absolutely decently functional in normal life gets into a 3 hour crying spree because an elephant has died, I would say that he or she needs to recondition their own internal strengths so that, yes, we all feel bad about it. We all feel a rage for people who do it, but it should not be to the point of destructive or sad. Yes, somebody who has a mental health issue, reach out, seek help, talk to your doctor. If you're already under treatment, get yourself corrected. That is how to move forward. But in either situation, Shweta, reacting for 3 hours is inappropriate.
Somebody wants to know, and this is something I've been I'm struggling to find an answer for. When there are fans dying because they are so shocked, and I have to really understand what is that state where family also couldn't understand that their family member could just, feel so miserable about somebody's death miles away. And
See, again, we need to understand the fact value behind it. There is something, what happens is when we hear something which is completely unexpected, completely means you can't even fathom and imagine something like that happens, and especially more so for somebody known to you. And this was, we are talking about, his sister-in-law, who was, like a family member. The shock itself led to release of that. There's a vagus nerve in our brain which brings about, which controls a lot of biological functions. So what happens is that when we hear something very unexpected and very shocking, it goes into hyperdrive. It's like a super allergic reaction, and that vagal discharge causes our heart to stop, like have a cardiac arrest immediately. So this is probably what have happened, and especially somebody you relate to. For us, he was a screen person. He was in the papers. But if you relate to somebody in flesh and blood, and suddenly you can't even think he was successful, doing very well. You probably met yesterday or you spoke to that person yesterday. Then for us, it becomes like, it's an unbelievable thing. The pain our mental system, our psychological system experiences. So the brain just shuts down. And when it shuts down, in unfortunately 1 to 2% of patients, this tragedy of your heart stopping, you having a cardiac arrest does happen.
there's somebody who wants to know if you don't feel like sleeping in the night because you feel that is the best time and you feel very peaceful, how to deal with that? Is that normal?
No, but do we don't sleep at all, or we sleep an hour or 2 hours late? That is something pertinent, because if we are giving an hour, 2 hours to ourselves, and it is not compromising my next day life, it is absolutely normal. This is called my time. I need to deal with my emotions, my time, my music, my conversations. XYZ could be anything. Absolutely normal. It is not. But if you're awake through the night for your my time, and you're sleeping in the day, compromising on a low, that is the time when it starts, becoming. So 1 2 hours of my time is absolutely fine. You need that. We all deserve that.
Great, great. I'll take a few questions from YouTube, sir, and then maybe we can wrap this up. An emotional, there is somebody on YouTube who says, are emotional people those who think too much, are more prone to depression?
Oh,
Overthinking.
yes, if you're more sensitive, if you think too much about, a particular topic, or you easily get affected by, what people's miseries are, yes, you are a little more prone and a little more sensitive to it.
Okay. If something bad happens to someone, I start to relate that to my life. Is it normal? Very good question. Happens to all of us. We are our own heroes in our own stories. Everything happens around us. We take it on like,
If something adverse happens to somebody who's on a similar campus, yes, we do take it on ourselves. Like, something like this today, we hear about it, a mishap happened to a doctor in COVID times, somebody was doing COVID, or we've heard of psychiatrists who got so overburdened, overstressed, that they went into alcohol, they went into depression, they committed suicide. So, that's something we relate to, and that's something that comes back to affect us or hit us way. But like as we say, as strong people, as fighters, we have to make sure that we do not let that thing affect us, so that our personality, we have to recondition and keep evolving our personality to make sure that the psychological strength which we have keeps getting added, so those things can stop affecting us, because these are inappropriate. Impulsivity to end yourself, get into alcohol, start abusing a substance, get into a rage reaction, are inappropriate according to societal norms, according to biological norms, according to the legal system. So we need to continuously, yes, it should affect us, but to make us a stronger and a better person, not a weaker person.
correct. I just need to say, Pranav, you're raising your hand. If you like, you can put the question in the chat box. Else, I will just take a few questions from YouTube first. isn't it better to speak your mind instead of keeping it in your mind, leading to eluded thoughts, maybe deluded thoughts?
But again, the expression of what I say is important, but as much as the way I express it. You know, a very inappropriate way of expressing a good thought or a good intent is completely distorted. You know, it is completely convoluted. So if I say things which I don't bottle inside, but it has to be said in an apt way so that it gets the message across and it doesn't hurt anybody.
Great. Sir, what if somebody manages to have that foot and mouth moment or faux pas, and you've said the best thing with the best intent, but it has really, it didn't land the way you intend. And then you get into that loop of regret, and it's so difficult to snap out of it. What would you
Again,
advise?
let the guilt and regret make you a better person to make sure that you never repeat it. And to whoever you've done it, there is no shame in going back and saying apologizing for it.
How do
As
you
I said,
snap out?
sorry,
How long does it take? I mean, if somebody falls into that loop like for many days,
if the faster you talk it out, the easier it is to get out of it. The more you internalize it, the more you bottle it, the more it comes to hurt you and harm you.
there is no clinical way of getting out of it. Eat pop a
Go,
pill and
go, go
stop
ahead,
thinking.
talk, go. There is a clinical way. Again, better than a clinical way, the same person who you did it with. If you can't, talk it out with another friend. It's basically a process. It's basically verbalizing. The minute you speak out, the minute you verbalize and you say that I did wrong, it could be just, like all the concept of confession boxes is based on this fact to make your guilt go away and to make you a less hurting. So that is what reach out, speak out. Forget a doctor, forget a psychiatrist. It could be a friend. It could not be the same person. It may not be the same person who you hurt, but it could be another person and to say, I'm sorry, I did it.
I think people who are not able to, just because they fear that they'll be judged or fear that they shouldn't talk to anybody about it, is something that is the point where it becomes normal, from normal to abnormal. They're not
Yes,
able.
because the bottle lid, sooner or later, the noxious thing is going to just build up and burst out in any other symptom. It could be a depressive, it could be anger, it could be physical symptoms. 30 to 40% of patients, they have physical symptoms of depression, what we call as somatic. So soma is your body. So psychosomatic is your connection between your brain and your body. We get patients who have who have loose motions, who have skin problems, who have a tummy ache which hasn't gone away for 10 years, and they've gone to all the doctors. And then when we start treating them as depression, they resolve within a month, 2 months, and they go back to a normal life without medication.
So there's a question I think we must take. He says, I recently had a breakup and the relationship is very old. I just can't get over it. I'm having thoughts of committing suicide as I'm about to lose many things together. I feel very depressed and unable to overcome it. Is there a way to move on from it?
See, firstly, what he needs to ask himself is that why did the breakup happen? Who was at fault? And it's something which did not last. It was not meant to be, and it wasn't worth it anyways. So, yeah, to hurt yourself, harm yourself, or commit suicide for another person, please outweigh it with the persons who've been in your life since the time you were born, your parents, your siblings, and somebody who's been in your life for 5 years, 10 years. Who takes a bigger way? I think your family, your friends, people would be. How much of hurt and pain you would be giving them for somebody who chose not to stick with you, or not even putting her at fault. Even if you had personality differences, this disaster would have happened if you would have carried on anyways. So when the pain of being together is exceeded by the pain of being separated, it's better to move on. It's better to call it quits.
Um, how to live with a toxic person in the house in this lockdown situation? Very pertinent question.
Now it depends on the relationship. It could be a sibling, it could
Husband,
be a
spouse.
husband. Sorry?
I think the person hasn't mentioned the relationship, but it's somebody in the house.
But I think if there is a relationship in the house and you can't escape that or you can't cut that relation, I think it's better to, at least withdraw a little bit. When we used to go to school, we used to read about, two numbers, highest common factors. Let's look at the least common multiple. So do not try and, go away 100%. Do, because that's a relation you can't break, right? As it's in the house. So try and be minimal, be on the fringe, try and be as minimal communicative, minimal interactive as possible. And I think that should help.
If it's a father,
Although there are no magic cures in a toxic relationship which can't be broken under the same roof, but these are small things which we can do to at least ease out the stress.
the person says the relationship is father.
Again, given that being a father and maybe 25, 30 years elder to him, take his cynicism, eccentricities, anger, whatever it is, and move on. Every person, there'll be a day when he'll be in the hierarchy as a father, and maybe his child, because of the generation gap, also says that, my dad or you are so tough. So we all have to, we can't wish away our father. We have to love them and respect them. So let's do our best.
Meditation has helped me to be around toxic people with ease. And also, I felt that people give you what they have. They have nasty things to give you. I mean, it's something like they can't control it. It's not easy for them. Okay, I think that should be a wrap. I will just have a quick look. Does depressed person feels more acceptance than others? Person feels need for more acceptance than others.
Again, as I told you, once you get depressed, you want people around you to support you, and then it becomes a bad conditioning. When you start feeling well also, you get into that attention seeking mode. So you should know where I actually need them and when they're actually becoming my crutches. So they should be there in your need, but they should not become your crutches, your relatives, your friends, your family. So yes, we do need them initially in the recovery phase, but they should not become a dependency. Always, you are an individual. You should be strong enough to go about once you're.
So depressed people take every comment in a negative way. How family members can counsel them apart from the doctor?
No, the family members again need to maintain a safe distance. They don't have to be judgmental. This is, if you have any problems, please speak to your doctor. They should not try to be subjectively say कि हमारे टाइम में तो हम ये कर लेते थे तो सब ठीक हो जाता था. ये depression होता क्या है? A patient who's depressed actually understands the pain behind it. Again, to summarize it, the only color which depression has is black, and which only the person who goes through it can see it. So the family members should keep an arm's length. They should be supportive and to seek help immediately. That's the role of the family members. Counseling is not their forte, so please withdraw.
How insensitive should people? This is something I did not understand. If the person can ask again, how insensitive should people should deal with situations? How insensitive people should deal with situations? So, if you could ask the question again, have you understood? Yeah.
Situations is a very wide word, So, like, what kind of situations? Depressive situations, people who are depressed. What we need to have a correct perspective of what the person is asking.
Great. So the person who had a sleep thing that would, out of joy, not sleep at night, says that I sleep by 4 or 5 in the morning and get up at 10:30 for office. Is that healthy? And
not a healthy way. Not a healthy way.
You need to do something.
You're breaking the normal biological clock. Just to tell you, we believe a lot of in our ancient scriptures and Ayurveda. The day breaks at 4 a.m. in the morning, and it's not just a religious thing or a spiritual thing. Biologically, the Western world also said it: early to bed and early to rise makes a man healthy, wealthy, and wise. So it's a biological thing. You need to follow your clock once in a while, once in 15 days. It's very good. break the mundane, break the monotony, but on a day-to-day basis, it's not physically and psychologically.
There's somebody who says if I'm going through an incurable mental illness which has made me disabled in my daily life routine, how should I go ahead with my career, a student of law?
See, again, I need to have a diagnosis, because there are mental illnesses which are incurable, but they are definitely treatable. So despite having an illness, despite being on lifelong treatment in terms of therapy, medication, you can go about your normal life in a completely normal way where the illness is silent. Nobody comes to know that you are ill. Now, whether there is a psychosocial intervention required or a medicinal change required, that has to be judged by once I know, or any doctor knows the difference.
Right. So there is one last question we can take for the evening, sir. Otherwise, we've really overshot the time. I really want to understand one small thing. As these days, diseases like PCOD, PCOS, and thyroid are really common. These are hormonal imbalances in the body. It also leads to hair fall, acne, and face being more emotional, crying at small things. People having diseases may lead to depression in later stage. So you've got the question, or shall I break?
Basically, it is known. Let's talk about thyroid. Thyroid is what we call as the regulator of our mood. If we have a thyroid dysfunction, the chances of you having depression is 99%. It's that strong. And just to again, to tell you, all the chemicals which are produced in the brain, if they remain in the brain, like I spoke about serotonin, or we keep hearing about dopamine, adrenaline, these, if they remain in the brain, they're called as neurotransmitters. But if they leave the brain and they go down to our, thyroid, our ovaries, our other, they are called hormones. So basically, the chemical composition is the same which is being produced. So one way or the other, they all are related to our mood, our physical. They both are interconnected. Physical symptoms can lead to depression, and depression can lead to physical symptoms. Again, a vicious cycle. They go hand in hand.
Okay, so she's asking that as symptoms like mood swings, happy at one time, low with energy another time, please throw some light on it. Is it all? Yeah. Yeah, that's what she said. Please throw some light on it.
No, but definitely being extremely happy at times and being low at times. This is what we call as a rapid cycler mood. Okay, rapid cycler is that first of the morning I'll be like running, going about things, talking to people, and by the afternoon I'm like I don't want to talk to anybody. I'm feeling low. I'm feeling. These are definitely signs of mood swings. So she needs to seek help and get in touch with the doctor ASAP.
There's one last question. The diagnosis is, this is an answer, is it? The diagnosis is fibromyalgia.
Fibromyalgia. Fibromyalgia is basically a syndrome which is characterized by extreme physical pain, lethargy, weakness, low-grade, mild fever, and a lot of other IBS. These all are part of fibromyalgia complex. All the symptoms mimic and come out as a physical disorder, but it is known and it has been classified as a psychological disorder which needs to be treated with mood elevators and antidepressants. That is how when we get the disease, fibromyalgia.
Right. So one last question for the evening is that when a lot of people tend to have suicidal thoughts, this is more like, and I believe that it is as injurious as cancer. It can, in fact, it can kill sooner than cancer sometimes. People in their 20s. We had a case here in class 12th. The child just got scared that the police is about to come to his house for something, and he just jumped off. So, if when is that stage where these thoughts actually lead to that action of committing suicide?
See, most of the suicides, Shweta, if you again get in literature, they happen because of impulsivity, and they are never planned. It happens at a spur of a moment, and you snap and you take that decision. If you give them an hour, if somebody is there to talk to them, if they get a companion at that point of time, the situation diffuses within half an hour to an hour. So this impulsivity, like you talk about the student who suddenly and got scared. This was not a planned suicide or a depressive suicide. It was an impulsivity. So we also need to understand that when we get these impulses, they will pass. We need to again just get hold of a family member, a friend, or even talk to ourselves that what am I doing? Why am I doing this? Life is precious, life is beautiful. The goods outweigh the bad much more. So planned suicides are very less compared to impulsive suicides. So we need to understand that impulsive suicides are very preventable. So this is what, as you talk about, we all have to reach out, not let that rage get that better of us, not let that anger get the better of us, not let that negativity get to us and take an impulsive decision.
People who tend to do this are not as reasonable. It's been my debate. This is what I'm struggling to find an answer.
Again, rationality has got nothing to do with reason, impulsivity. And impulsivity can come to anybody at any time. The only thing is that we should be able to just close our eyes for 1 minute, take a deep breath. This is gonna pass. I'm not gonna feel like this. This is not, if I've done a mistake, it's not the end of the world. If I've made an error, it's not the end of the world. There is support, there is recovery, there is healing. There is a correction, there is a repentance, there is a comeback. That is what we need to tell ourselves. It's not about rational or irrational. That particular moment, we need to, get hold of our rationality. Otherwise, you be a rational person and you'll still be happy. But during that time of impulsivity, that rage, that impulsivity needs to be done.
I agree, sir, but clearly some people didn't think that way. That is what hurts me. Okay, how can I get an appointment these days? Okay, so there are people, this is for the people who would like to contact you, sir. Can I share your number if you like? Or
please, otherwise my contact details are available with my name on the net. So if they just put in my name also, everything is available.
Great, great. So if you have an extramarital affair, last question, sir, can we take this if you have the time, sir? If you have an extramarital affair and you are guilty about it, and can that lead to
fibromyalgia? Yes, of course, because see, that is one part of your emotions. You can't even speak to your closest friends, right? You can't go and say, okay, that there are two people I love in my life, which is though very much possible, but you can't express it. So when you come in front of your spouse, you feel guilty about it. When you go to the person you are in love with or having an extramarital with, the pressure of expectations or the guilt there also, even if the person is non-demanding or expecting in terms of a lifelong marital relation, but that guilt always is there. And of course, the fear. What if one but the other person comes to know? So these are not healthy things, and this is something you can't verbalize it. You then the only thing left in this situation is either to rationally close one of the relations. It could be a married relation. There is no bounds on that. There is no prizes on being in an unhappy married relation. It's like you have to understand, but it's better to close one relation and settle down peacefully rather than trying to jump boats. That can be
correct. So it's not restricted to mental health. It has physiological issues as well if one continues.
It's a very funny situation that how beautifully the body and the mind are coupled. Shakespeare said it that the face is the mirror of the mind. If you're happy, the face will look beautiful. If you're unhappy, we'll all look very bad and ugly.
I'll just take last few questions from YouTube, sir. It is more, okay, so they're all asking for the contact details of, so this is, he's online, and if you can just look up with his name from the poster you read and attended the webinar, you'll be able to find. There is somebody who's asking for the NGO's Delhi number. For the
I will send it to you. Shweta, I will send it to you within the next 10 minutes. You can post it.
Sure, sir. Maybe we'll do that with our next session. Thanks for the timely session. So there are a lot of compliments your way, sir. They're saying that they could really relate to everything that you said. It was a very timely session. So that is also, that's a compliment we can share, sir, because We
Thank you so
organized.
much. It's my honor and it's my pleasure. Honored to
So,
be on with you. Please take care, stay happy, and stay safe.
so one last question. It is something I can't resist taking. How to overcome fearful thoughts? Example, if maybe going outside tomorrow, how to stop thinking that I may be attacked. So this is something like if somebody is taking a flight, they have this fear of, so these are fears which are depressive, or how do you rate them?
No, no, these are basically anxiety issues, claustrophobia, as you said, a flight, a lift. There are people who are, afraid of heights. There are people who are afraid of insects. So these are basically phobias. So for them, 99% of the time, therapy and 1% of medication works wonderfully. But I'll tell you an easier way. I'll tell you a very easier way rather than meeting a doctor or taking medicine. Go face your fear, and the fear will run away.
Right. One last, and this is very
Because to overcome fear, there's a beautiful saying that says that something that doesn't kill me only makes me stronger.
correct. Yeah, I believe in that.
Right.
If it didn't kill me, it made me
It
stronger.
makes me stronger and it'll take away the fear.
Correct. Does spending time on social networking sites more than real people lead to depression?
Majorly. It's one of the biggest, it is one of the biggest causes of anxiety, depression. In fact, we have a wonderful new term, and it is a diagnosed illness in our textbook now. It's called nomophobia. Have you heard of nomophobia? Anyone? It's called no mobile phobia. It's like if you take a flight, look
That's a
around
real
next to you.
term. That's a real term, or you
Yes,
coined?
it's a real term. It's a diagnosed illness now, which says that now next time when you take a flight, and if it's a long flight, although we know there's no network, you'll see people switching their phone on and off just to see if there is anything, and they know there's nothing on a beach. So loss of connectivity, loss of what is happening in the social world, it actually become a major anxiety issue and an anxiety issue.
So a lot of places I see in a lot of countries, people don't talk to the person next to them, but they talk on the phone all the time.
And also, I was going to complete this only. We are
Strange.
now we are only beginning to love machines. We are only beginning to interact with mechanical emotions, real machines, real affection, real time spending. That skills to communicate, my social skills, everything is taking a beating. So let's not do this. Let's make it a point to switch it off at a particular time and give the phone also this and give our also some peace and rest.
Sure, sir. Great. Very nice session, sir. Thank you so much for taking the time and effort today. We might call you again, sir, because there are some questions still. However, it will be a different topic in the same area.
It'll be a pleasure as always. You take care. Thank you so much for having me over. Bye-bye.
Thank you. Thank you, everyone, for joining. I hope the session helped you all. See you next time. Thank you.